I have family members who work in the NHS, which I'm very proud to have. 9 years ago, the party opposite passed the Lansley reforms, and for 9 years, the NHS has suffered the consequences of that disaster. We've seen creeping privatisation, fragmentation of services, and a lack of adequate funding. For patients, that's meant disjointed care and soaring waiting lists made worse by COVID. And for healthcare professionals, it's meant that the NHS is no longer a hospitable place to work. Before the pandemic, the service had a vacancy rate of 8%. That's 100,000 vacancies. And I know from discussions with a variety of professional bodies and unions that there are significant skill shortages which are only going to get worse. Last year, a survey from the BMA found that 45% of doctors across the UK experienced depression, anxiety, stress, burnout, and other mental health conditions. How is it right that our professionals in the NHS are so overrepresented in those experiencing mental health problems? The RCN have found that 36% of nurses were thinking of leaving the profession, and YouGov reports that a quarter of NHS workers are more likely to quit their job than they were a year ago due to low pay and understaffing. While ministers have clapped for carers on their doorsteps, many of my constituents who have worked in the NHS rightly say they don't want platitudes. They want to be heard. They want a proper pay rise and an end to top-down reforms which do nothing to address the real needs and their real concerns. For them, this bill is more of the same, but it's also an indictment of the 2012 Health and Social Care Act. It's the government's admission that they have failed. But rather than learn the lessons, they've doubled down on the failures. There's nothing on waiting lists, nothing on vacancies, and despite the Prime Minister's promise of a plan for social care, nothing on fixing the system that the pandemic has shown is not fit for purpose.
Quite right.
Rather than reinstate the duty of the Secretary of State to provide a comprehensive health service, or reverse the privatisation of the NHS, or reinstate the NHS as a default provider, the bill allows private providers to sit on the boards that decide how NHS money is spent. It's astounding, but not surprising, that after 9 years of failure, and after a year of handing millions of pounds to Tory cronies for useless PPE and a failed privatised test, trace and track system, the government is now proposing to increase the influence of private companies in the health service. Unfortunately, on all these issues, the bill has nothing good to say. And even worse, it says all the wrong things.